Morehouse School of Medicine, one of 5 historically black colleges and universities that comprise the Atlanta University Center, is dedicated to improving the health and well-being of individuals and communities. Established in 1995, the Master of Public Health program at MSM provides the public health theory that supports the social mission of MSM. An institution recently ranked number 1 among U.S. medical schools in that regard. The mission of the MPH program is to develop, through graduate education, public health leaders who are fluent in community-focused public health research and practice, particularly in underserved communities. 20 years later, we have over 300 graduates working in the field of public health or pursuing advanced degrees. Our mission is to be the leading national model on community-focused public health education, research, and practice, particularly in underserved communities. Helping to carry out our vision are our public health core faculty leads, Dr. Gemetru Gerby for biostatistics and epidemiology, Dr. Elaine Archie Booker for social and behavioral health, Dr. Renetta Waldrop for health administration, management, and policy, and Dr. Stephanie Mouse Richardson for environmental health. Dr. Mouse Richardson also leads the charge in carrying out our vision as the Assistant Dean for Graduate Education in Public Health and Director of the Master of Public Health program. Preparation.
I am a veterinarian, and as a veterinarian, my interest is pathology. It's the study of diseases. And so when I finished veterinary school at Tuskegee University, I received a postdoctoral fellowship from the National Institutes of Environmental Health Sciences to pursue a PhD in pathology and environmental toxicology. And I ended up learning about the Agency for Toxic Substances and Disease Registry here in Atlanta, and understanding more about what they do in terms of toxicological hazards and protecting people's health. So I started my career in public health at ATSDR as a commissioned officer, United States Public Health Service.
I have a training, a PhD in epidemiology / biostatistics, and then I also had experience at CDC as an EIS officer. So my training, practical training at the CDC, and then PhD training at Tuskegee, I'm sure qualifies me to become a faculty member.
I received a bachelor's degree from Howard University, and that was in the health field. It was pre-med. I received my master's in health systems management engineering from Georgia Tech, which was devoted to managing health environments and creating environments that were more effective and efficient operationally. And I have my doctorate in public health with a concentration in health policy, policy development from the University of Georgia.
I'm a nurse, an RN. I graduated from Georgia State University with my BS degree in nursing. And because of my nursing background, I went to work in local hospitals, Crawford Long during that time, and mainly Grady. But one of the things that I did do was I did work with the Fulton County Department of Public Health. So I got to see opposite end of the spectrum, dealing with prevention and then actually seeing tragedy coming into the emergency room. And a lot of that enlightened me to that we need to do more in prevention.
Path.
But when I went to CDC as an EIS officer, I always wanted to come back to academia. That means I had a training, PhD training in epidemiology that qualifies me to become a faculty. At the same time, I wanted to have applied epidemiology experience. That's why I went from Tuskegee to CDC. But when I wanted to stay just 2 years to get experience. Then I had amazing experience at CDC. And then the key is that after I finished my EIS training, I wanted to come back to academia, especially in schools and programs on public health, because I would like to teach. Or I would like to show my love of epidemiology and biostatistics and I would like to teach students, so that I would like to produce or train public health professionals, so that by doing though, I would see that that would make a great impact on public health nationally and internationally.
My career choice as faculty was not really a choice that I made. I came to Morehouse School of Medicine originally as a consultant. I came here as a consultant that was working on grants. I was dealing with teenagers, and that was kind of my area of specialty when I worked at the health department.
I never really decided to become a faculty member. I think probably that career choice maybe chose me. I've had many years of experience in teaching.
Faculty member. But over the course of being here as a consultant, I got asked to teach classes. And from that is how I got to be on faculty here at Morehouse School of Medicine.
I think what drew me to becoming a faculty was the opportunity to not only practice what I know, but to teach that to other people so that they can do more. So I'd had experience with underserved populations, environmental justice communities, and I could only do so much. So I think being a faculty member kind of intrigued me, or I became attracted to it because of the ability to teach others to do that which I knew to do.
I then became a graduate assistant while I was at Howard University exploring and working on a master's degree. And I had the opportunity to do some teaching in the zoology program department. So I taught labs and taught students and tutored and that sort of thing. I think later on, what I found myself drawn to was the idea that in just about every one of my career professions, I winded up having some sort of teaching activity associated.
Call to service.
What drew me to the academic discipline of public health was, again, teaching the applied aspect and sort of matching that with the theoretical constructs of public health. There are things that one has to learn to do, and then there are things that happen in the field. And so having been in the field, having been with communities who are distraught and having to learn how to deal with the politics of public health and the injustice and the justice and all of those things led me to want to come into an academic arena and to be able to not only teach that theory, but to give some real world examples of how that is applied.
I was drawn to public health also because of some of the positions I've held. Every organization that I have actually worked in has been an organization concerned and consumed with the public's health. You know, Grady Hospital is the Atlanta area's foremost public hospital. So not only did we do a lot of individual health activities, but we did a lot of public health activities while I was at Grady.
It was a blessing to enter into the public health because of this devastating impact of HIV/AIDS in Africa, which is Ethiopia is one of sub-Saharan Africa highly impacted by this devastating disease. Not only this, but infection and chronic disease. This country is highly impacted by these diseases. So the background is basically started in my country of origin, and I got my PhD degree, and I went to CDC and EIS officer and became disease detectives. So I think that is a brief answer, the pathway for me to become one of the leaders, and it's a privilege for me to get into as one of the public leaders or public health leaders.
What drew me to the academic side of public health was the medical side. Being a public health nurse and being an emergency room nurse, I saw the need to teach what I saw that we need to teach. And one of the main areas that I saw, we were not communicating with the community. When I got patients coming in from the emergency room, a lot of the questions that I'm asking them about their diet, whether they're taking their medication, their family histories, those things, they didn't have a clue of how those dots connect. And the people that work with them, a lot of the colleagues that I work with, didn't understand that it's a root base that we have to educate people. And if we're going out to teach people, we need to understand the impact of what we're teaching and how powerful that can be. So,
Contribution.
I think part of my contribution is that I can probably help the broader medical community profession here at MSM understand how important public health is to the overall health of individuals.
Integrating the community to understand that it's not just out in the community, it come into the hospital. You need to know how their community, their lives influence, whether they can take medicine, whether they have medicine, the money to buy medication, whether they have the money to buy the right food. We could say that they need to eat these things, but is it financial for them? Can they get back and forth to the hospital or to their doctors? So we need to teach them to understand, dig deeper. When someone says, I have not taken my medication, ask a question, why? Is it because I want to take it, I don't have the money to get it, or I can't get to the drugstore, or those factors? So that part is what I think I bring to this public health program.
So Morehouse School of Medicine is interesting institution because it is a medical school, but the vision of this medical school to lead the the vision of this medical school to lead in the creation the vision of this medical school to lead in the creation and advancement of health equity means that it has to do more. So it not only has to train physicians and to deal with primary care, but it has to keep people healthy. So public health fits really well here. We also do discovery, research, community engagement. So the contributions of this program, of my discipline in this program at Morehouse School of Medicine is immense because of what we're here to do.
In summary, I think my interrelated activities of teaching, research, and service here at Morehouse School of Medicine would help us to be on the national and international stage. And I foresee and I believe that this contribution would help us to be a leader in public health. And then I do see that this is a great contribution, but I don't want to make it a big deal. But I think I have to make it clear that this is because of team approach.
Drive.
I do see that the value of my contribution from the MPH program, of course, Morehouse School of Medicine. So the support that I get, and then the feeling that I have that I am the valued member of this community would always get me excited and get going. That is the main driving force for me to continue.
Everything that we do is public health, and that we must, even these times are very important that we do integrate public health. So that's what keeps me going, because I see with the lack of funds that we're getting ready to see, and a lack of people in the arena that really care about the basics, that's what keeps me going, because we need to keep our population educated, the younger people, because a lot of us my age, we're getting ready to retire soon. So we have to have the foot soldiers ready to take our place.
As a faculty member in public health, just helping students to understand how all of those pieces of the puzzle fit together when it comes to our health care, to me is real important, to help them walk away with a real knowledge and understanding of, what it takes to have a healthy country,
I come to work every day because students keep coming back. And the students come and they want to learn and they want to change the world, and that's what we're here about. So as long as we have excited, teachable students who are ready to go out and do great things, I'm coming every day. That's what brings me back every day.